Hello, it's Dr. Ronald Lett from the Canadian Network for International Surgery. This is the most important lecture in the Fundamental Interventions Referral and Safe Transfer course. In fact, this may be the most important lecture you get in your career. It's on expert thinking. You as frontline health workers need to be experts. Patients come to you for expert decision making. How do you do expert decision making? What I want you to do is classify the patients. Now, I'm emphasizing making decisions, not making the diagnosis. You need to make decisions based on the patient's risk. Diagnosis comes later. Experts don't worry about the diagnosis right away. They worry about the risk of the patient. Is the patient low risk, medium risk, or high risk? What's the difference? The low risk patient is the patient you treat locally. You as a frontline health worker should be taking care of all the low risk patients. The high risk patient is the patient that you should not be taking care of, but you need to resuscitate them and safely transfer them. The difficult patient is the medium risk patient. You need to treat them locally and actively observe them. The medium risk patient is the patient you don't know how they're going to turn out. We have done studies on patients at medium risk. What happens to some of them? They come in with, let's say, abdominal pain, and you give them some analgesics. They come back the next day, and you say, they're not better. Let's give them antihelminthics. They come back again another day, and you give them antibiotics. By this time, you have delayed their care 3 days. We have shown that delaying patient care results in a 6-fold increase in mortality. So today I'd like to give you a rule. The 24-hour rule or the 12-hour rule, depending on the situation. Surgical patients, patients with other problems that you're not sure about, if you treat them locally and they're not better in 24 hours, you refer them. You don't try a second treatment, adding another 24 hours, and a third treatment, adding another 24 hours. You end up with a 72-hour delay. So, your job is to treat locally all the low-risk patients. Your job is to take the high-risk patients and resuscitate them and send them on their way, but send them safely. The medium-risk patient, the patient that it's not clear about, you treat them. You can't send them all away, but if they're not getting better, you must send them on their way. You don't try again. The only way that you're going to know that they aren't getting better is if you actively observe them. So, we want you to be an expert thinker. We want you to classify every patient you see as low risk, treat locally. Medium risk, treat locally, but if they're not getting better in 24 hours, and in the case of obstetrics, if they're not delivering in 12 hours, you transfer them for better level of care. The high-risk patient, you resuscitate them and you safely transfer them. So this is how you will become an expert, by classifying patients according to their risk and treating them according to that. We'll go on to the other whiteboard to practice looking at how we do this.